Welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Today we're discussing something very unique, which is secondary infertility. Now, secondary infertility occurs when someone who has had a child before struggles to conceive again. It can be caused by factors such as age, health issues, hormonal imbalances, or lifestyle choices. Now, infertility affects millions of people and has an impact on their families and communities. Now, estimates suggest that approximately 1 in every single person of reproductive age worldwide experiencing fertility in their lifetime. And on Healthy Living today, I am here with Dr. Gilbert Nnaji, a medical doctor and reproductive health expert, who is an author and founder of FertilityCode Naturals, a wellness company. So join us as we discuss this today. Stick around. Yeah, welcome to the studio once again, Dr. Gilbert Nnaji. Really appreciate you for your time today.
It's good to be here again.
Honestly, it's good to have you. All right, Dr. Gilbert, there's been a lot of conversation around secondary infertility. In fact, most women would say, oh, I had my first child without a problem, so why am I having a challenge with the second child? So maybe you help us brush on what it means to have secondary infertility or infertility in general, because I know that you have something called, you're the founder of FertilityCode, which means that you have some sort of hack around this fertility solutions. I've seen a lot of women testify. I went through your page. I see a lot of testimonies. In fact, I had a first-hand lady that told me about, oh, how Dr. Gilbert helped her and all of that. So I want you to throw more light on this, because a lot of women are battling with secondary infertility. So help us brush on what infertility is generally, and then before you now help us narrow it down to, secondary infertility.
Okay, nice one. So it's actually into categories. Infertility can be defined into categories, actually. Okay. There is the primary infertility and there is the secondary infertility. Now, the primary is actually the inability, for a couple to achieve clinical conception after 12 months of uninterrupted and unprotected sexual intercourse. For 1 whole year, 12 months. That is primary infertility. It hasn't happened before. But for secondary, is the inability for a couple that has had a pregnancy before to conceive again. You understand? They've had it before. But then they weren't able to conceive again.
Yes.
That's secondary infertility in the simplest terms of explanation. And then you want to find out what are the causes, what are the causative factors for this secondary infertility.
Yes.
And then you ask yourself, someone that has taken in before, let's say 2 years ago, let's say she lost the pregnancy or something happened. What are those things that are responsible? What are the things causing the delay?
Oh, sorry to cut you there. Does it mean that if someone has just taken in before, but they probably lost the pregnancy, it's not like they gave birth to the child, and then they are struggling to get pregnant again, that is already secondary infertility?
Yes.
Oh, because the first notion that people hear when they talk about secondary infertility is that, oh, you have a child, you carry the child to full term, then you are struggling to conceive again, then that's what people understand, or maybe many of us thought was secondary infertility. We didn't know that it had to do with maybe just even conception, even if you give birth.
Conception. That is secondary fertility.
Oh, okay.
If it takes longer time, let's say 2 years, 3 years, 5 years, as long as there was a previous conception, it is secondary infertility. That is what, according to WHO. Now you want to ask, what are the reasons, what are the factors? Why is this woman not taking it? Not just the woman alone. Remember, it's a couple. It has to be a couple because it takes two to tango.
Yes.
You have to bring in a man too. You want to find out what are those factors, what are the causes of this delay. Then you want to start what are the things common in our environment in Nigeria. We look at the woman. Age is one of them. Age-related factors, like a woman that is over 35 years and above. She's almost 40. A lot of them will begin to experience reduced ovarian and poor egg quality. Reduced ovarian reserve. So by that age, the woman's egg, the quantity of her eggs, will have reduced. It will start reducing from time with time when she's closing up to 40 years old. So she has what they call reduced egg quality and egg quantity. Because every woman from birth, according to stats, they have up to 2 million eggs in each of the ovaries.
Okay.
2 million pyramidal follicles. So as she grows with time, begins to menstruate, she will start losing those eggs with time.
Oh.
Yeah, so those eggs reduce with age. So by the time she's up to 40, it will have really, really gone down in quantity. So the fewer ones might not be healthy. And the quality of the eggs will also reduce by activities of poor nutrition, environmental factors.
But Dr. Gilbert,
Yes.
sorry, I still want you to talk about the quality of the eggs, but I'm curious to also know,
Okay.
does the quality of the eggs now, does it affect the filter, maybe the child that comes out?
Of course it does. Most of these chromosomal issues that children carry from birth, from the womb, they come as a result of poor egg quality. Most of them.
Wow.
That is why the commonest age of miscarriage is usually when the woman is close to 40 years old. That is when most miscarriages happen. So that is one of the causes according to medical science. Okay. So women that are up to 40, they are prone to miscarriages, which is tied to the quality of her eggs.
Wow.
Compared to a younger lady of 25 years, you know what I mean now. They take in, that's why you see it commonly, young girls, they are the ones that go for termination of pregnancy because they are quick to conceive. They have very strong, healthy eggs. So for women, as a woman ages, fertility declines.
Wow.
So what I advise or advocate for them to do is to improve their egg quality using natural alternative like herbal supplements.
Okay.
And it works. Even right now, before coming here, one of my clients called me yesterday and told me that she took in, without even knowing it, she was preparing for IVF. And then she took in, she's almost up to 40 years old, close to 40.
Wow.
And she did this egg quality improvement and she's pregnant. She's so excited. So
Wow.
we now laughed about it. Yes, just yesterday.
Oh, wow.
She was preparing for IVF. And I was actually preparing her for that. And lo and behold, she had taken in. So it's something that works.
This is good.
Yes.
Wow. So you were talking about the egg quality,
Yes.
and you talked about some of the factors that could affect the egg quality.
Yes.
I hear you talk about poor nutrition, environmental factors.
Yeah,
Yes.
environmental factors, even toxins, some of the things we consume in our environment, like even radiation, it can affect the woman's egg quality. Our place of work, even stress, when you're exposed to maybe psychological or physical stress, that one falls in the category of hormonal imbalance. Then number two, another cause of secondary fertility, hormonal factors. Okay, hormonal factors can affect the woman from getting pregnant, especially if she happens to have what is called hyperlactin. Medically, it's called hyperlactinemia.
Okay.
And it presents with a woman expressing breast milk abnormally when she's not even lactating or when she's not pregnant.
Randomly.
Yes, she expresses.
And that can cause infertility.
Yeah, it is a sign of hyperlactin hormone secretion. It suppresses the hormone responsible for ovulation. So any woman, you're not pregnant, neither are you lactating or breastfeeding a child, and you happen to maybe touch your nipple and something comes out like a fluid, it is not normal. It is a symptom of hormonal imbalance called hyperprolactinemia medically. So it can also cause infertility. So even in the clinic, when a couple come for clinical assessment or for consultation, it's a routine for me to examine the woman. I like to check, okay, can you do this by yourself? Or maybe if I have permission, I can do that for her, and then I check. If there is an expression of breast milk, it's already a physical sign of hormonal imbalance called hyperprolactinemia. So she has to treat that before she can take in. And a lot of women, they have this particular child I'm talking to, they don't even know it. So when it comes to hormones are very, very key for conception.
Okay, so let me ask about this notion that people have. They say when you're breastfeeding, you tend not to get pregnant.
Yes.
Is it in any relation?
Okay, let me explain the analogy for you. Let's say there are two women now, Jessica and Jane. Jessica is pregnant. Jessica just put to bed. So it's natural for her to be lactating.
Yes.
Even the baby's cry would stimulate the brain center to start expressing breast milk. So it happens naturally.
Yes.
So when because the hormone that induces breast milk production is called prolactin.
Yes.
So when she's making breast milk, the baby is feeding on the breast milk. It's that hormone prolactin suppresses the hormone responsible for ovulation, called FSH, follicular stimulating hormone, and LH, luteinizing hormone. It suppresses it.
Okay.
Because it's not. That is how God is very amazing. because a woman that is pregnant cannot take in, that is breastfeeding, can't take in again now.
Okay.
And so nature stops that
Okay.
by suppressing the hormone responsible for ovulation. So it's more like a natural contraception, breastfeeding. As long as she's breastfeeding the child exclusively for as long as 6 months or more, it would be hard for her to take in. But when a woman, Jane is neither pregnant nor lactating nor nursing a child, and she is expressing breast milk, then something is wrong.
Yeah, that's
Okay,
true.
the body would then, get this false perception that I'm pregnant. So sorry, that I'm actually carrying a baby.
You're
or
carrying a
breastfeeding.
baby, yes.
Therefore,
So,
we shouldn't get pregnant. It's a
True.
false information. Unless she sees a medical practitioner or a fertility doctor, she wouldn't know that she has that problem. And for such people, there are causes to that. One of them is stress. Two of them are poor dietary intake. Some diet that women consume can lead to that kind of hormonal dysfunction.
nobody would have associated your diet to infertility, because it's amazing. I'm just hearing that from you for the first time.
Yes.
And another thing I wanted to draw your attention to is the fact that I've seen a scenario where a lady is breastfeeding,
Okay.
and because of the fact that she has a notion of when you're breastfeeding, you can't get pregnant. In
Yes.
fact, while she was breastfeeding, she was not menstruating. So it means that you're safe. But she got pregnant, I think
Yes.
4 months later.
There are some very rare cases where it happens, and I like to tie that effect to not breastfeeding exclusively.
Okay.
Yes, I like to tie that because this is what the common knowledge for doctors, that if a woman is lactating and breastfeeding a child exclusively, the prolactin will be so high because this woman is making breast milk. The child's cry is even stimulating more breast milk. So it naturally suppresses ovulation. It should suppress ovulation. But when it happens, it means that either she might not be breastfeeding exclusively, one way or the other. And that's because, but it's not very common. It's very rare to see a woman that is lactating or breastfeeding getting pregnant when she's breastfeeding. It's very rare. But sometimes things can just happen that may be difficult to explain.
True.
In her own case.
Very true. Very
Yes,
true.
yeah.
And maybe sometimes they say some things defy science.
Absolutely.
Okay,
Yeah.
so I know that you've mentioned some of the causes of the secondary infertility. You mentioned age, you mentioned hormonal imbalance. What other factors? Because I've seen some women struggle with maybe I think some persons mentioned fibroid.
Yes.
I think some persons have dysmenorrhea. I don't know if dysmenorrhea
Yeah.
has anything to do with infertility at any point.
Very correct.
So I want to know what other factors are
Yes.
possible to, prone one to.
Okay, I was
secondary
coming to that.
infertility.
Another
Okay.
factor is called uterine factor.
Okay.
And so under uterine, that is where this fibroid comes in.
Oh.
The activities that can hinder conception within the womb, within the uterus, that's where fibroid comes in. Now, fibroid can cause infertility when it occludes the entrance into the fallopian tube. And you and I know that fallopian tube is the channel that allows the sperm and the egg to fuse to form a zygote, baby or embryo. Okay, so if there's a myoma fibroid blocking the entrance into the fallopian tube, the sperm will have nowhere to pass through. So that can cause infertility. And then again, if the fibroid is at the layer where implantation happens, it's called submucous layer in the womb. If it's occupying that layer where the baby should normally implant after fertilization, then it will be difficult for conception to take. And a lot of women, they have this challenge right now. Another one too, if the fibroid is actually, if the baby eventually implants and the fibroid is lying side by side with the baby, it's going to compete with that child and eventually suffocate that growing embryo, and that will be a miscarriage. So that is why fibroid is very, very common nowadays, and people that have it, they should really go for care. You get to find out, the location of this fibroid, how much danger it can pose to their pregnancy or to their future pregnancy, so that they can do something about it. Either they can do a myomectomy surgery removal, or they can take some treatment that can help to shrink the fibroid down. That is for under uterine factor fibroid. Then next is endometriosis. And I don't know, you might have had some people that I can't go to work today because I have excruciating pain. That pain is commonly due to endometriosis for a lot of women. Pain that does not allow you to go to work.
And this kind of pain is during menstruation?
Exactly.
Okay.
It comes. So what is endometriosis? It is when the layers of the endometrium they are seen outside the endometrium, places like the ovaries and the fallopian, because they have tissue that bleed. You know, endometrium is like a bleeding tissue.
Okay.
Like it bleeds every month. That is layer that bleeds for women to see a period. So when those layers are seen on certain areas inside within the pelvic cavity, the fallopian tubes or the ovary, it will still bleed on those organs. So when the bleeding stops and it begins to heal, it will form inflammation and scar formation. It will close, that fallopian tube. That is where infertility also ensues. Okay, even if it also happens on top of the ovary, it can even frustrate ovulation process.
Wow.
Yes. So endometriosis is another common cause of infertility under uterine factors. And a lot of women, they're actually going through this challenge now because formerly they've had a pregnancy before and then they're now experiencing difficulty in getting pregnant, which is what the secondary infertility. So that is. Then the other one is tubal factor.
Okay.
Because the fallopian tube is a very important tube because that is what conveys the sperm and the egg for conception to happen. So when there is something called tubal blockage, okay, the common causes of those activities are things like STI, sexually transmitted infections, and even PID, the one you know about is a woman, pelvic inflammatory disease. So its infection can also lead to tubal blockages. Okay, infection commonly. That's what causes tubal blockage. And sometimes to surgery, maybe CS can predispose one to, if the doctor or the surgeon didn't do a good work, there could be, iatrogenic factors, maybe mistake from doctor, tampering with the fallopian tube, and then injury needs, then there'll be tubal blockage. Sometimes they may not, after the procedure, they may not handle the organs well, to be so distorted. So that can also affect conception for a lot of women. Then there's also a place for lifestyle factors. Okay, lifestyle factors. Let's say she's not eating well, not eating the diet she's consuming, are poor diets, fast food. All these are fat diets. Our designer foods.
A lot of us are now guilty of that.
Yes.
Stir fry here and there.
Of course, and they can result to hormonal imbalances.
Oh.
A lot of them, hormonal imbalances, obesity. Where they don't have nutrients, as you already know. Those are not. They don't offer your body any benefits. It's just too much of fat, too much of sugar, and they end up causing hormonal imbalances in the female body, delaying conception. So these are factors, common factors that can result to secondary infertility for women. Whereas for the men, we have things like...
I was going to ask that, is it just women that experience this? What about the men? Do they have these challenges as well?
Yeah, definitely.
Okay.
Men have their own factors. Let's say low sperm count can affect men from conceiving. And they want to ask, what are the causes of this? A lot of them take alcohol. So alcohol consumption can, affect the overall sperm quality. It can even affect sperm count. There's also what's called motility. When the sperm is not actively strong to move towards the egg, it can also cause delay. And some of these men, prior to when they got their wife pregnant the first attempt, they didn't have this problem. So they went back. They now started indulging in certain habits. So that now led to secondary infertility. Because a lot of them were wondering, what is happening now?
Most of the time, in the African society, they don't even now look at the man. They don't even think that the man could be the problem. The angles they look at is the women. They treat the women more. The reason why I said so is because I have a friend who's actually battling with secondary infertility.
Okay.
And we got talking. She would talk about how often she goes to see her doctor, how her doctor is treating her, how this is this, how that is that. But I asked myself for a moment, could it possibly come from the man? So I told myself, okay, I can't tell until I've asked a professional if this can also be from the angle of a man. Because if they feel like, okay, the woman is okay, just keep trying, keep doing this, keep doing that, and then you keep, putting in all the efforts, and it looks like it's the woman's body that probably can't hold the baby, or it's the woman's body that is not taking in, but the man, of course, you had your first child, so maybe it's you now. I didn't know that there are angles to even the men having the challenge. And this is you throwing light on this.
Yes, because like I said before, it takes two to tango.
Yes.
And so in our society, because of African society, we find ourselves, people put more emphasis on the woman bearing the offspring. It's been there for a long time.
Sure.
My great grandparents, they are the ones that imposed that on the society, that made it to be so. So people look at women as the primary person that should responsible conception and for childbirth. But then, and on the other hand too, women seem to have more problems, more biological problems, so to speak, than men. But it doesn't mean that people should put all their attention on women only, but men too should be, be queried, be brought. They should also come to the table and then help to solve the problem. So what we need is awareness, really. Is to educate women, educate men, because naturally they seem to be at the head of the family and the head of the relationship. So they are mostly in control. They just make the rules and all that. But that's not very good. They should also understand that a lot of women go through this problem emotionally, and a lot of them, it affects them, even prolongs the conception for them. Okay, if women are, if this matter of infertility is approached with enough care and responsibility from the part of the man and support, it's go a long way to ameliorate the sufferings of these women. Because sometimes you see them, most of them come to the clinic alone without a partner.
True.
And that's not fair. That's not good enough. Because now frustration, mother-in-law is pressuring you, society is pressuring you.
Then you're personally pressuring yourself. Age is not by your side. This is also going to lead me to a scenario that I want to paint for you and have you comment on. So there's a particular true life story that I actually read about. A lady in her late 30s was struggling to get pregnant, and then she eventually took in. It's been bothering her, but she eventually took in and she tested positive. And then went to the hospital. No, she didn't go to the hospital or something. I really can't remember. I think she was, according to the book I read, I think she was trying to treat herself and all of that. And then she went to the hospital and told them to check her. And then they said there was nothing in her tummy. But she was growing. The tummy was growing. Her looks had changed. She had every signs of pregnancy all around her. And then the doctor said there's no baby in the belly. But she refused to believe that there's no gestational sac. There's nothing developing. And then she felt like she was truly pregnant. 9 months passed, 11 months, 12 months, 1 year. And people kept looking at her. People were around like, this child is not enough to give birth to this child. But they keep telling her there's nothing in your tummy, but tummy keeps growing. Only for her to discover that she was truly not pregnant. It was her mind that was messing with her. So is it possible to have this kind of case? Because when I read it, I thought it to be untrue, even though it was a true life story.
Well, it happened. I think I've heard some story, but then I've not seen one. I think what I would call it is psychological misconception. You're thinking that you're pregnant, and then you've gone to the doctor and you are assessed, because where would the baby hide now if you're pregnant? Scan will reveal any pregnancy.
Yes.
Scan will reveal fibroid. Scan is one
I had to bring this up because you mentioned the emotional part of it. So I figured, I think maybe her emotions took the trick, and played the better game with her. That's why I had to ask you if these things are possible and how to resolve this kind of, or detach, so that you don't get to this stage where you begin to think that there's actually a baby in your tummy. And in fact, in a typical African society, they'll probably be saying it's village people that have taken the baby away from the belly. They'll probably not understand that, there must have been something that has triggered this. But so that's why I'm asking if there's some sort of emotional space that people get to that triggers this kind of hormones that begins to produce whatever that makes them feel like they're pregnant and look like they're pregnant.
It's just frustration, really. Just the frustration. There's nothing to it. She's just being normal, Some women, they don't have the coping capacity to deal with infertility. Some women, they don't. And those ones are the ones that they require proper counseling. And unfortunately, we don't have such in this environment. It's rare. If you're abroad, you have a therapist, they can give you therapy, coach you, help you to handle your mental health. Most likely, sometimes you just feel like they want to lose their mind and all that, because, like I said, not every woman has that coping capacity to deal with infertility. Not every woman. It's a very difficult challenge. Very difficult, especially when this one has pressure, when there were high expectations in the marriage before it can just be very frustrating. With such women, they need counseling. They need therapy. They need help, maybe from a preacher, or so to speak, to help them deal with that problem.
You know, I was even going to ask you that. Don't you offer such services? At least maybe have a therapist alongside whilst you're attending to these women, because I know that most people that would come to you will probably be coming from a place of very, very low state. So how do you get to handle this?
You're looking at a therapist by situation. I've become a situational therapist.
Oh my God.
Do you know how deep this work has taken me? Sometimes I don't even have my own time. I go back to my home to rest. I'll be getting called 12 a.m., 1 a.m., 3 a.m. Someone else called me out by 3 a.m. Doctor, I need medication. I'm tired. My husband insulted me. I'm telling you, I can imagine. It has engaged my life completely. I have a community on WhatsApp, and they are big, and these people are always chatting me any time of the day. If not for that community, my work would have been very difficult. Because I can't even imagine not giving these people support.
True.
That support is medicine of its own. It's like a prescription.
Dr. Gilbert, that's where I want us to touch on, but let's quickly go on a break so that when we come back, we'll be able to do better analysis and look for solutions to some of these problems. All right, viewers, I'm sure you're enjoying the program, and we've been discussing secondary infertility, and we've looked at the causes, some of the factors that actually cause secondary infertility. And we're going on a quick break. When we return, we'll talk more on the topic. Stay with us. Welcome back, viewers. We're still discussing secondary infertility with Dr. Gilbert Nnaji. And if you missed the first segment, you've missed a lot. You have to go back and rewatch again. All right, now, Dr. Gilbert, before we went on that break, I know you were talking about some of the supports that you've had to give to your patients. You've become a situational therapist. And we know that these are some of the things that women go through, even though not everybody comes out to say. And the society is highly demanding. In fact, after a first child, they'll start telling you, what are you waiting for? They don't even care what you do or what's going on with you, or if you even decided that, oh, I want to space my child this much. They just already start demanding, what are you thinking about? What are you waiting for? Time is going. Have all of them at once. That's another sort of pressure on its own. But what can women do, to handle these societal pressures that come with infertility, or when next are you having a child? Because I know that sometimes the anticipation can even make you not get pregnant. So what can women do?
Okay. Now we are moving towards the mental part of fertility.
Exactly.
Okay, psychological part of fertility. Now, the human actually, this is the concept I believe in, made up of spirit, soul, and body. Okay. Now, when a couple, a woman is making effort to conceive, it is normal routine for her to see a medical doctor, and then doctor will examine you, run some lab tests for you according to the symptoms you're presenting with, and then prescribe you treatment, medication. Or if the challenge is a difficult one, he could recommend IVF for you to do. Those are physical intervention treatment approaches. What if this woman's problem is not physical or biological? Then we'll begin to look at the mind. And some of my colleagues are not trained to deal with that challenge. These are the ones that it takes longer time for them to conceive. They are the ones that even go crazy in the process of trying to conceive, because they've done a lot, they're taking on medication, they've done IVF multiple times, they're not able to conceive. So I think I'm happy that people are beginning to see the mind as a part of the human entity.
True.
Unlike before.
Yeah, I think it used to be traditions that made people believe that there's nothing called mental health, there's nothing around your mind and all of that.
No, I'm glad that nowadays people are beginning to pay attention. My colleague doctors, because for me, I am so passionate about the mind. I understand the mind to a very good extent. I know that it plays a role in fertility and conception. And I also educate women about the impact of the mind. Okay, because especially when you are exposed to a very toxic environment, it affects fertility. It weighs you down, affects your emotion, because you're focused on the wrong thoughts. So when you focus on the wrong thoughts, it affects the way you feel. When you affect the way you feel, your organs get the same information. Your organs also be depressed. Because your organs can get depressed too, don't you? Do you know that?
No, I'm hearing that for the first time.
Of course. Okay, something called somatism. For instance, now someone, let's say you didn't prepare for exam, you didn't study well for exam, and then suddenly you hear that the exam is coming up the next day. What will happen to you naturally? How will you respond?
Fear.
Pew.
Worry.
Fear, worry. If you're not careful, you'll have diarrhea.
How do I start? Anxiety, yes.
If you may have diarrhea. People have had diarrhea from such emotional outburst. Diarrhea,
Yes.
even urination, it's from the mind. Because normally you don't have diarrhea. Why should we suddenly have diarrhea? But doctors treat diarrhea with pills and medication. But you're because of what you
Diarrhea
heard.
is in the mind.
So you see, it's in the mind.
Yes.
The body is subservient to the mind. So when a woman gets a particular information that is negative consistently for a very long time, mother-in-law is on your matter. You're seeing your friends carry the baby, you go to church, you see Thanksgiving, you're getting those information. You're not getting any encouragement. The body gets that information and it suppresses fertility. Yes. You understand?
Absolutely.
So a category of women are going through this challenge, and God help them. How would they know what is causing the delay? You've taken pills, no answer. You've done IV, no answer.
And sometimes they'll tell the women, you are perfectly okay, just keep waiting. Without checking the mind, without knowing if this is also a challenge.
Without checking. So for short women, that was when I now discovered that my community that I started like almost 5 years ago, it is fulfilling a need. I have a WhatsApp community that I give time, educating them, supporting them, giving them emotional support, encouraging them, motivating them, and I see the impact. They depend on that community so much. The kind of testimonies I get from my community, I even wonder, like, wow, is this how far this thing has gone? They are so appreciative. Okay, like last 3 days ago, a client of mine that took in, she was due for conception, for delivery, and then we happened to tell that period, and I called her, I said, what happened? She said she's due that day. I said, okay, what are you waiting for? She said she wants to have it natural birth. I said, natural birth, what's the weight of this child? She said, 3.9 kg. I said, 3.9 kg, that baby is big now. Why not do a CS? She said, no, I don't want to. Before I knew, she opted for discharge, for transfer. That she didn't want to do CS. I said, oh, come on, this child is a precious child.
Take a risk, yes.
You know, you've tried for almost about a year or 2 years. Why not just go for cesarean session? It is safe, it is okay. Not that the doctor is competent, just go for it. She was being double-minded, and after 3 days, she has not still entered labor. So when she not entered labor, there was a delay. So I called her again. I said, what's happening? She said they went to one clinic in, I don't want to mention the name,
yes.
that they're about to, that she's, how many cm, dilated, 7 cm. I said, for how many days now? I told her, please just go for CS. It is safe. If you're in the US or UK, nobody even take all permission from me. They were just willing to the theater, bring out the baby, and then that'll be all. So she later paid attention. I spoke with her husband. They now went for the CS. Then, after about 2 days, she now sent me an epistle, telling me how much I've done for her.
Oh my God.
Sent baby's picture to me. It was just a very emotional period for me. She was in my group. She posted it. People were just commenting. They were just telling me thanks. How I called her during labor. So you see that emotional support.
True.
It is very, very like it's like a treatment for those people. I have to do it to help them, to encourage them. It offers them so much. This is beyond pills and medication. It's beyond it. Fertility, there has to be emotional support. Otherwise, it will be difficult for them to deal with these challenges.
And it's obvious that this emotional support does not just have to come from families, doctors as well. Because I've seen situations where some doctors literally, some doctors, like I said, would literally kill their patients with their words.
Yes, that's true.
I've had the experience.
Yes.
Like, I went to see a consultant gynecologist, and the things that she told me could literally have even gotten me to probably pass out in the process. When I heard everything she had to say to me, I looked at myself, I was like, oh my God. And then I had to seek, I think I sent something to you because I had to seek another content. I had to seek another opinion.
Remember.
Because the things that she had said to me was something that could have gotten me to,
yes.
am I sure I can still be in this world?
That's true.
We get to patients. I'm not the only one that must have experienced that. There are lots of other women that must have had these kind of experiences. And some doctors are very terrible at their job. So I think it's also an avenue for you to also talk to, say some things to them and to be patient as well, because it may seem as though maybe not just one opinion is perfect enough, because some people can give you a death sentence already with just their opinion.
Yeah, the thing is, like the way now, like I already have been experiencing, this knowledge of mental health is becoming common nowadays, other than before.
Common knowledge, yes.
So people are beginning to understand that there is the mind when it comes to human health. You also need to address mental health issues. It's
Yes.
also part of healthcare. So it's all about being open to learning.
Yes.
You know, if your son is open-minded, no matter how high you are as a professional, you should know that you need to incorporate mental health education into your practice.
True.
You know, it's not those days that you want to just dish out anything to the patient. No. Some of them even have the knowledge of mental health. So they maybe the ones that are intelligent, they may just reject that information before you and say, no, just like you told me. And a lot of them, they go online, they search information. So doctors should, I think they should know that mental health is very, very key. It's part of health, overall health care, that we should also know how to deal with certain issues. You cannot just openly pronounce a negative result to a patient without understanding that she has a mind, she has emotions. You have to know how to manage that information. As a matter of fact, even as a fertility doctor, it's part of my training, how to talk to a patient, how to counsel a patient. It's the curriculum. Even when I want to break out a negative result that didn't turn out positive, there's a way I talk to this patient that made them not to break down. Someone that did IVF or IUF, for example. I cannot just call you and say, madam, this thing is negative. No. I will call you in, talk to you in a proper way, manage your emotions, and then I'll tell you, okay, it's not positive, but in a way that you will not feel bad. You understand? So
Yes.
that is what we are now beginning to do other than before. And it helps this woman to cope with such a bad news.
And probably even want to take a try again.
Definitely. It's the way you manage that information. You have to, like a pro. You know, like
That you're expected to be.
Yes, like a pro. Just
Because when patients come to you, they expect that, you know, most patients, when they come to their doctors, it's more like, oh, doctors are supposed to save my life. So getting a negative result from a doctor is already a problem.
Yes.
Some persons don't even survive it.
Some don't. They couldn't. A lot can't even cope with that kind of negative report. A lot of people. So you need to know how to manage that information. You have to be on the part of the patient, be on that understanding, have that empathy to talk to this woman in a way that she can be receptive, and then she would then not flare up from the bad news. So,
All right. So when we look at solutions to secondary infertility, I remember that while we talk about, I know you mentioned fibroid, there's also a case of those ovarian cysts also cause infertility in women.
Yes, it does.
Okay.
It does. Whereas even PCOS, you know, last time I had PCOS with you.
Yes, yes.
So they can also contribute to secondary infertility. Ovarian cysts, not all of ovarian cysts can also result to that, but then some of them disappear with time. They resolve with time, ovarian cysts. The ones that are difficult to resolve, maybe such person could opt for an intervention, maybe surgery or to aspirate the fluid. But a lot of them, after some time, the cyst resolves after some time. The one that is much more common is the PCOS.
Yes, this PCOS now, is it possible to have PCOS in a case of secondary infertility?
Of
like
course.
a woman has already conceived before and then eventually she now has PCOS. Is it possible?
Yeah, because
Okay.
it's clinically a condition of hormonal imbalance, which is androgen hormone, PCOS.
Yes, I remember you said so.
That is what makes those cysts to develop, because they say that hormone is a male dominant hormone, and the woman has this in excess. It will develop cysts, multiple cysts in the ovary, preventing ovulation and conception. So it's common. A lot of women have that challenge, and you can know because there are physical symptoms or signs. Some part of the women will have hairs with the chest area and the jaw area, and then some other ones, commonly skipping periods or irregular menstrual cycles. You see this month, you don't see the following month, just like that. Difficulty in getting pregnant, sometimes obesity for them, ultimately infertility. And then if you want to find out, you have to see a doctor. So once they scan you, they will see it visually. It has to be there.
No.
You cannot hide visually. When you do a scan, you see it. So once you discover that you have PCOS, you now start working on your diet. That's one of the root causes of PCOS.
Wow.
Poor diet, poor nutrition, unhealthy diet. So you need to start with diet to correct that problem. And I've had a lot of people that did it, and it worked, and a lot of them took in.
Yes, I know one of your patients that has results.
So that is also where doctors are beginning to now understand that food is also medicine. Because why do I call food medicine? It came from the soil.
True.
The real food comes from the soil. under the soil and they have nutrients. Where are the vitamins? Where are the minerals? They are under the soil. So food carry those minerals into our bodies. That is the real food, not the ones that are made in the lab. You know, all those fast food, they can the food and leave it for like 1 year. You go and open it and you call it food. Is that food? It's not food now.
People believe that so long as you can feel your tummy when you're hungry, you've eaten food.
It's
you know,
not food. Those are the root causes of our problems.
Hmm.
You know, that all the obesity, most of the problems that people are battling with now, they come from poor dieting, other foods. But Africa, health-wise, is doing well. You know, America, in other foreign countries, you know, it's out of control. You have all the fast food restaurants everywhere. People don't get food from the farm. You know, and nowadays you have GMO food, and Nigeria is beginning to
tilt towards it.
So God help us.
Okay, we believe we're going to get better. So let's talk about some of the solutions to those infertility issues, especially based on those factors that you mentioned.
Okay, now the solution is to see a trained practitioner.
Okay.
Okay, see preferably a fertility doctor.
Okay.
Than going about it. You're not a doctor. Don't go and waste your money and hurt yourself in the process. See a well-trained doctor. Let them approach it according to how they were trained to address that problem professionally. Now, when you see a doctor will take your history, your health information, document it in your folder. If need be, do some assessment on you, physical examination, send it for some text. So the test will then reveal the cause of the problem. It's not determining the kind of treatment that will be given to the patient. It will be tailored to the patient according to the problem. That is how to deal with these issues of fertility. I see couples when they go here, and they eventually come. By the time they've come, the one is almost entered menopause. They've not seen a doctor for like 10 years. They've been going from here to here, doing this, doing that. When they come, she has already entered menopause. What do you do? I said, okay, you can't take it naturally. You should try IVF. And some of them don't even have the money to do IVF. So that's when it becomes very frustrating. So there should be massive and intentional efforts to educate people about these things. Okay. To seek help early enough is very, very important.
But, in seeking help, people would say there has to be some expected signs and symptoms that I get to see that makes me know that, oh, I think I may not be on the right path. For instance, now you talked about improvement of egg quality. Is it possible to know when your egg quality is poor whilst you're menstruating for the month? And when do you know that, for instance, I already have endometriosis? It's not just normal pain. This is beyond the usual, and I have to seek help.
You don't even know if endometriosis. How do you know?
Oh, really?
There are many reasons for pain. So many causes of pain. Okay, pain in the pelvic region. It might be infection. It might be fibroid.
During menstrual pain.
Yeah?
During menstruation.
Yes. No. Okay. Whether it's menses or not, there'll be pain. Maybe there's pain. You're experiencing pain. There are things that we call it. What do you call it? Differential diagnosis. Is it fibroid? It can cause pain. Is it PID?
Which one is PID?
Pelvic inflammatory disease.
Okay.
Is it urinary bladder infection? Okay. Is it kidney disease? You don't even know. Is it endometriosis? Is it ovarian cyst? So this thing can elicit pain. This condition, they can elicit pain. So you cannot just tell yourself I have endometriosis. You can't. The best thing for you to do is to see a professional. Get proper assessment. Don't do self-medication. Otherwise, you may end up choosing the wrong thing. You understand?
Very well.
It doesn't mean that you must spend money. You may not spend money. You may just get the information and then you go seek your solution elsewhere. But then you see a doctor first. They are trained to find out the reason for certain discomfort in the human body.
Because I know that most women, when they go through this kind of discomfort during menstruation, in fact, it's been like that for some from a very tender age. They go through lots of menstrual pain and it's like a norm. So every year it increases. As they grow older, the pain increases and all of that. And every time they tend to abuse pain relief, pain medications, some sort of pain killers, they tend to abuse it. In fact, their body even becomes resistant to them. So in that case, do you see infertility in view when people have such cases?
Do we do it?
Do we have infertility in view when people go through this kind of phase every month?
Not exactly.
Okay.
Because, when you say infertility, you want to ask, is this person married? You can't define infertility when someone is not married.
True.
Okay.
But somehow, sorry to cut you, somehow people tend to keep that in mind. I had a friend who was having a conversation with me one time. She was like, I want to get married before I'm 30. So I said, why the rush? Not because it was bad, but it was more like, oh, my 30th birthday is next month, but I want to get married before then. But you're not in any serious relationship. So which means that you're putting yourself under pressure of whoever comes, you're willing to get married. So what's happening? And she was like, okay, I have had to look at my environment. This person is over 30, this person is over 30, this person is over 30. They are married, but they have no kids. They look at all those age factors and they want to rush into marriage because they are considering, what if I'm infertile? So there are also people who think about these things even when they are not yet married. But there's that worry there that, oh, if I go through pains like this every month, would I still be fertile when I get married? Or is this any sign of infertility that I'm only supposed to discover when I eventually get married?
The thing is, I understand that we have such kind of people in our society. So what I will tell such person, or my advice is for her to go for counseling, see a doctor. Because normally people should even advise to go to a hospital for comprehensive laboratory tests for at least once or twice a year.
Okay.
It's okay to do that. So when you're doing that, you can even include some certain tests of fertility like pelvic scan. You're doing a checkup actually. And you'll be told if something is wrong with you. It's okay to do that actually. It's okay to do that. You can go to a doctor, you want to do a checkup, you then check those areas, check your womb, do a pelvic scan, do hormonal test, just to know now. It's your body, it's part of your body now, whether it's fertility or not, it's part of your overall health. So it's okay to check. It's okay to check in that perspective. Okay. But then what I wanted to make you understand is this. You cannot tell yourself you have a particular condition when you've not done the necessary investigation or test to find out, like for instance, for pain. Because some women could even have menstrual cramps.
True.
A lot of women I know, when they are seeing their period, they have pain. And that pain is normal because there's something called prostaglandin in the womb. Once the woman is menstruating, those things are released. It helps to contract the uterus. So that contraction is a painful process. If you contract the uterus, you push out blood. Contract, more like a hormonal system. When it contracts, it pushes out the blood. Because without that womb contracting, the blood does not just run like tap water. It's the contraction that makes the blood to come out during period. You understand? So that contraction is a cramp. It's a cramp. But it's not when the cramp is now severe.
Yes.
Okay, let's say on the scale of reference, let's say 1 to 10, you can even tell yourself it's almost 10 or 9. And that, you cannot just still tell yourself it's endometriosis. It's not your place to make that diagnosis. The doctor will tell you that. But it's not, even me, I can't even tell a woman, I will just have an idea. It might be. It's going to be a differential for me. But then to establish a diagnosis, I need to start to a test.
Some test, yes.
For me to be satisfied, otherwise I'll fail the exam.
Because I know that some women go through excruciating pain. Like, it's consistent. I was speaking with a lady and she was like, the pain wasn't this bad, but it has become so bad that it's consistent. It could be on for 2-3 days. So when you mentioned endometriosis, the first thing that came to mind was, I hope it's not it. And I hope it doesn't lead to infertility. And she said, as she grows older, it gets worse. So does age have any factor to do with that?
Endometriosis?
Yes.
No. It's just that the progression of that condition, that is why she said as she gets older, it gets worse. It progresses. You understand? Like having malaria, 1+, 2+, 3+. So it progressed. It didn't get better with time, rather it got worse with time because she didn't do anything about it.
Wow.
Yes.
So it's possible but most of the time when they go to the hospital, doctors probably just give them injections to relieve them of the current pain and then send them back home.
Yeah, because there's no absolute medical care for that condition.
Wow.
Yes, that's the truth. There's no absolute medical care solution for endometriosis. Maybe it will come later, but right now, There's no absolute medical solution or cure. It's just pain management pills, medication to manage the pain.
There was also something you touched on that I wanted to draw attention to, which was you also talked about fibroid. If it's in some positions, could actually lead to infertility. Now, there are cases where some women have treated fibroid, but they say it came back. In fact, very recently, one Nigerian celebrity mentioned that she had a case, and then she said it's back. So she was saying she wants to follow and chase after other treatment options. She's tired of the usual orthodox method. She wants to go through the unorthodox method. You know, there are conversations around fibroid coming back again. Is it possible to undergo a surgery and still have a resurfacing of fibroid?
Yes, that's the way fibroids present. Fibroid, it's a very stubborn tumor, benign tumor of the endometrium. So, you know, it's because of the presence of the female hormone called estrogen, which feeds the fibroid. So it has a tendency of regrowing even after removal. Wow. Unless this woman enters menopause, that is when this estrogen hormone, every hormone in the female body declines or plummets. As long as she's premenopausal, you know, it will likely grow back again.
But not all the time does it disturb.
Some women, a lot of women, it grows back. But right now, I think there are studies that one can actually use certain vitamins, vitamin D, to stop the growth of progress of fibroid, even some nutrition can be used to also halt the growth of fibroid, and people are beginning to try it. Others are getting results, while others are not. But generally, fibroid is a very stubborn tumor. You know, not all treatments work for fibroid. Some may not be lucky enough. Some will need to do surgery, even more than twice, unfortunately. So, what I advise women to do to just do the right thing.
Yes.
Eat the right food. Do not eat what will harm you. Do not eat what will take away something from your body.
True.
Eat what will add benefit to your body so that you can be far from those conditions.
In fact, in rounding up now, I want you to give your advice to our viewers, especially women undergoing secondary infertility, how best to manage the situation, and what best to do, and what kind of lifestyle to continue to live going forward.
My advice is to adopt a healthy lifestyle, number one. Don't be afraid of seeing a doctor, no matter the reason, financially or not. Make a doctor your friend. At least that counsel, advice is what's gold, so much more. So you can actually get a lot of support and help from seeing a medical practitioner or a fertility expert, just for them to advise you and give you the right knowledge how to manage your health, fertility-wise. And then also, get used to running some laboratory tests. Get to understand your body. You understand? Because that plays a precious, how do I even call it? The precious, like, I'm looking for a word to use, like heaven, like heaven, where baby grows. Like paradise, yes, paradise. So you have to take care of your body.
But people, sorry to cut you, people have a mentality of if you don't have a problem and you go searching for a problem, you must find a problem.
Well, that's philosophy I don't understand. For me, they say prevention is better than cure.
Absolutely, even way cheaper.
Don't wait until something happens to you. That is why at least once a year, please go for a comprehensive laboratory test. Just check. People drive car, you do oil, you put...
And maintain your car,
the human body will not want to know how your body is doing. No, I don't advocate that. So it's okay for you to just do a checkup once in a year. Even before even being married, you can just go for preconception test, check your man, check your sperm count, know how you're doing. Because a lot of men guzzle alcohol and smoke. You need to know how you're doing. Those things end up in certain organs. You need to check yourself.
Sure.
Make it a routine to check once a year. It's just self-love, how you show love to yourself by ensuring that, okay, I'm on top of my health, I'm in charge, I know how my body is. It gives a different kind of feeling and confidence.
All right.
Okay.
Thank you very much for today, Dr. Gilbert Nnaji, medical doctor and reproductive health expert, and also the founder of FertilityCode Naturals. Thank you so much for your time
Thanks for
today.
having me.
Thank
It's good
you.
to be here once again.
All right. Thank you so much.
Yeah.
All right, viewers, I'm sure you've learned a thing or two today. Remember that doctors are your friend. Do not be scared of getting to see doctors. And prevention is cheaper than cure. Learn to always check yourself. I am Olamide Alasan, and I'll see you again next week. Bye for now.